A hearty good afternoon and welcome to a session on what you need to know about IVF screening. What we need to know about IVF. We are glad to have Dr. Malti Madhu among us today to help us understand this topic. IVF or in vitro fertilization is a medical procedure whereby an egg is fertilized outside the body. And IVF can help achieve pregnancy when other treatments have not worked. The doctor will help us understand this and help us in the consideration of IVF, whether it's necessary or not. So, doctor, you have the stage.
Namaskar. This is Dr. Malti. Uh, I am going to discuss today in brief about the procedure of IVF. As we all know, IVF is one of the most effective treatment available nowadays. It's widely available now everywhere to help the couple whoever are struggling with infertility or having difficulty in conceiving. So IVF means basically in vitro fertilization. In vitro fertilization means fertilization of egg and sperm outside the body in the petri dish. So we will be discussing in brief where IVF is needed, in which cases IVF will be effective, what are the pre-IVF tests, how to go about the procedure, and then the results. So, what are the conditions or indication of IVF? We all know that talking about infertile couples, about one third of the cases, the problem lies in female partner. In another one third, the problem is in male partner. And in the remaining one third of cases, there are some contributory factors in both the partners. So, IVF can be needed uh, accordingly. I mean, IVF can be done because of problems in female partner, like some of the PCO patients need to go for IVF. Then severe endometriosis cases, then tubal factor infertility where the fallopian tubes are blocked. Also, some cases of low AMH or poor ovarian reserve, IVF is the best treatment sometimes for them. Then talking about the male counterpart, IVF is needed in those cases of male infertility where there is severe deficiency in the number of sperm. As we all know that the normal sperm count in the semen sample is about 15 million per milliliter or more than that. So whenever there is severe deficiency in the number of sperm or the motility or morphology of the sperm is affected, then IVF may be needed. A couple of days back, some of the patient asked me that what is the morphology of the sperm. So I would like to say that morphology means the structure of a sperm. Sometimes there is structural difficulty in the sperms. So the head or tail or that a portion of a sperm is damaged. So, if the sperms are severely damaged or less in number or motility, they are not moving. In those cases, IVF ICSI is the most effective treatment. ICSI is one step ahead in which, in place of normal fertilization, we actually fertilize each egg. We inject one sperm inside the egg and thus in that way assist fertilization process. That is called ICSI, ICSI, intracytoplasmic sperm injection. So ICSI is a very effective treatment for those men whoever are having severe defects in the sperm. Also, in some cases where the sperms are not present in the semen sample at all, these cases are called azoospermia. So, in cases of obstructive azoospermia, or even in some cases of non obstructive azoospermia, IVF and ICSI can be done if combined with the procedure of TISA. TISA is another surgical procedure in which sperms are directly taken out with the help of small surgical process. The sperms are directly retrieved from the testes, and those sperms are used for ICSI. Those sperms are immature, so those sperm lack the power, lack the ability to to directly fertilize the egg, so assisted fertilization is needed in those cases. Then there are cases where unexplained infertility is there. What is unexplained infertility? Unexplained infertility is a condition in which uh, the regular ovulation is occurring, both the tubes are patent, and the semen parameters are also okay, but the patient is not conceiving. So, in some cases of unexplained infertility, there are problems with fertilization. So, IVF ICSI helps in those cases. Now, what are the pre IVF tests, or how do we prepare the IVF patient? It's always better to do these tests one cycle prior to the actual IVF procedure. So, how do we go about that? Basic blood investigation of the female or male partner is done. The basic blood investigation includes CBC, then random blood sugar, TSH, and then thalassemia screening, and all the viral markers are done. Also, the test for ovarian reserve, that is AMH, is done. And if there is any problem in the status or sugar levels, then that is corrected one cycle prior to get the better result. Then a baseline ultrasound scan is also done. Uh, and then the female is asked to wait for her cycles, start of her cycles. Then for male partner, all the basic blood tests are done, and then semen analysis, detailed semen analysis, and semen culture sensitivity is done. And as the cycle starts, on the second or third day of the cycle, the female is asked to visit the IVF center. Then we perform one baseline ultrasound scan and hormonal test for her. FSH, LH, and E2 is usually done on the second day of cycle. And if everything is normal, then the injections are started to stimulate the ovary. In IVF, we need number of eggs to develop on each side of the ovary, so injections are given. The injections that are usually given are recombinant FSH and LH injections, and usually the injections are given for 9 or 10 days continuously. Then monitoring of the cycle is done with the help of periodic ultrasound examination like follicular scans, and also blood tests in the form of E2 level are done periodically. Then usually in 9-10 days the follicles are ready, the follicles are getting matured. So once the follicles get matured, then we give final trigger injection. The trigger injection is very important because according to the timing of trigger injection, the process of OPU or oocyte pickup is scheduled. It's scheduled around 34 to 36 hours of the trigger injections. Trigger injections are the injections of HCG, recombinant HCG, or GnRH agonist injections. Then she is instructed to get prepared for OPU. On the date of OPU, she is called with her husband with empty stomach, and then the process of OPU is done. The oocyte retrieval process itself takes about 10 to 15 minutes to maximum 25 minutes. That is according to that timing is according to the number of follicles that are developed in the ovary. But usually it takes 10 to 15 minutes. The process is done under anesthesia. So the women after the procedure uh, is there in the IVF center for observation for 2 to 3 hours. Then she is discharged on the same day. This is a daycare procedure. And the husband is asked to provide the semen sample. The fresh sample is always preferred, though IVF can be done with frozen sample of a sperm if the husband is not available on the day of oocyte pickup. But I also prefer my patients to give fresh semen sample. That is always the gives the best result. Then, on depending upon the quality of semen on that day, the embryologist decides that whether IVF or ICSI is needed in that case. So that is done accordingly. On day one, fertilization checkup is done. So after fertilization checkup, further growth of embryos is monitored in the lab. Conventionally, transfers were done on third day. Day 3 embryo were transferred inside the women. But now most of the labs are going for blastocyst culture or day 5 embryo culture. That gives the best result. Blastocyst transfer gives best result. So most of the labs are going for blastocyst culture. So transfer can be done in the same cycle, that is called fresh transfer, or the frozen transfer. In some of the PCO patients, not some of, mostly for PCO patients, it's always better to do frozen embryo transfer because that gives best result. So if the fresh transfer is planned, the woman is called again on day 5 of the oocyte pickup procedure, or and transfer is done. After the transfer is done, the result of IVF can be known after 2 weeks by a simple blood test called serum beta HCG. Some support medicines are prescribed after the transfer, and the woman is given all the necessary investigation. She can carry off her normal routine activities, though bed rest is needed after the transfer. So, in all those cases in which fresh transfer is decided, the woman is asked to wait for her another cycle to start. Usually, after the procedure of OPU, it takes about 10 days for the cycle to start. On the first or second day of cycle, she is called again, and then first or second day of cycle, she is called again, and then baseline scan is done, and some oral medicines are started for lining of uterus. And once the lining of uterus is there, that almost takes 13 to 14 days, and then progesterone is started and transfer is done. Talking of embryo transfer procedure, that is not painful procedure at all. It is done under ultrasonic guidance, and it is the procedure is done under OT only to take all the aseptic precautions. And after the transfer, she is instructed to lie down for 30 minutes or so, and then she can go home. uh, the result of IVF can be checked with the help of doing blood test, that is serum beta HCG, that is done 2 weeks after the transfer, roughly 2 weeks after the transfer. So this is in nutshell all about the procedure of IVF. Now talking about the latest techniques that are sometimes used in IVF. First is blastocyst culture, that is used by most of the labs now. Blastocyst culture is always preferred because blastocyst culture gives us the best result. Then laser assisted hatching. Laser assisted hatching is something that has increased the success rate of IVF. But laser assisted hatching is not routinely done. It's done when the female's age is more than 35 years, and or if there is history of previous IVF failure. So what we do in laser assisted hatching, we slash the outer membrane of the embryo with the help of laser so that it hatches easily and attaches to the surface of endometrium. So just to facilitate the process of implantation, laser assisted hatching is done. Another is embryo glue. Embryo glue contains hyaluronic acid rich media. So hyaluronic acid rich media, whenever it is used during transfer, it increases the success rate of IVF. So then TISA and micro TISA. TISA and micro TISA are the other surgical techniques that are used in cases of azoospermia. When no sperm is present in the ejaculate, so the sperm is directly taken out of the testis with the help of these surgical procedures. Then what are the complications of IVF? Patients often want to know that is there any complication of IVF? Usually, IVF is very safe procedure and it is easily tolerated by the women. In some of the cases of polycystic ovarian cases, I would like to stress that not in all cases, but in 0.1% of cases, there may be development of ovarian hyperstimulation syndrome or OHSS. What is ovarian hyperstimulation syndrome? Ovarian hyperstimulation syndrome is a condition when there is extra or over response from the ovaries. Polycystic ovarian cases have multiple number of eggs or follicles. Sometimes with when the hormones are administered to these women, then all the follicles start growing simultaneously. So there is swelling in the ovary, and there is there is fluid collection, not blood collection, fluid collection around the ovary. So the patient feels bloated. So there are many precautions that are taken in such cases. Uh, there are recombinant injections available, and minimal dose of those injections are administered in such women. Then the cycle is closely monitored, and also the trigger injection, different type of trigger injections are used in these cases. Different type of trigger injections that are safer, like GnRH agonist injections, are used in these cases. Another precaution is transfer is never done in fresh cycle. Whenever we suspect that there are chances of ovarian hyperstimulation, we freeze all the embryo. We instruct the women to wait for periods to start, and then after periods, as the hormones come down, the effect, whatever is due to the injections of IVF, that effect is washed off with the periods. Then we can make the lining of uterus and transfer the embryos. That gives us best result in PCOS patients. Then, what are the factors that decide about the IVF success rate? The IVF success rate, conventionally it was about 40 to 45% per cycle, but now with the use of latest technology, I mean laser assisted hatching, blastocyst culture, embryo glue, and everything, it can be achieved in almost 65% of cases in their first cycle of treatment. So, what are the factors that determine the success of IVF? First of all, is the female partner's age. If the age is less than 35 years, the success rate is better. After 35 to 40 years, the success rate decreases. Another is whenever there is history of previous conception or previous live birth, that is in women with secondary infertility, the IVF gets better results. Then semen parameters also, as we all know that the embryo is made from the oocyte of the female partner and the sperm of male partner. So quality of sperm or quality of eggs are also important for that. These quality of sperm or egg determine the quality of embryos. So better quality of embryo will give us better result. Then the lining of endometrium is also important. It should be around 8 to 9 at the time of transfer. If consistently the lining is less, then there are other procedures that are done to know what is the cause of this poor endometrial lining. In some of the cases of this genital tuberculosis, the lining of endometrium is less. So it becomes important in those cases to rule out genital tuberculosis. And then there are also some procedures like PRP, platelet rich plasma installation inside the uterine cavity, that also help us to make the proper lining. Sometimes hysteroscopy is also needed to look into the uterine cavity before we do the transfer. So I think I've covered in a nutshell about the IVF, important points of IVF. You please let me know if you want to know the details. If you have any questions, you can put that questions in comment box. Thank you. The question we can take that how much ICSI and TISA? I guess he wants to ask that how much effective is the ICSI and TISA. As we all know, TISA is done in cases of obstructive azoospermia. Obstructive azoospermia means when there are no sperm in the semen sample. But with hormonal tests like FSH, LH, and testosterone level that are needed to determine that whether the TISA is going to help us or not. If FSH, LH, and testosterone are in normal range, then definitely you can go for TISA. There are fair chances that we can retrieve the sperm from TISA and use that sperm for ICSI. There are there are no more questions. Okay, thank you for your patient hearing.